Hi guys! Today's video is all about what happens when you visit an IVF doctor for the very first time, what discussions take place between yourself and the doctor, and most importantly, what questions you should be asking the doctor. Now, before you go in for your first IVF consultation, some clinics may ask you to do two things. Number 1, fill out a questionnaire with regards to your medical history. Number 2, they will also ask you and your partner to carry out blood tests. The medical history form may ask you the following questions. How long you've been trying to conceive for? If you've had any previous treatments done? How regular is your menstrual cycle? Have you had any previous pregnancies or miscarriages? Are you currently taking any medication? Whether you or your partner are smokers? Whether you or your partner have had any surgeries in the past? And of course, they'll also ask you about your family history. The blood test that you're going to be doing will check your hormonal profile and any past infections. For the woman who's creating the eggs, they will have a blood test done on cycle day 3. This will check their FSH, LH, estrogen, and AMH levels. They will also have a blood test done on cycle day 21. Day 21 checks a woman's progesterone level to confirm whether ovulation has occurred or not. The man providing the sperms will also need to do a blood test which can be done any time before the appointment. They will also be asked to provide a semen sample, so an analysis can be done to check their sperm's motility, morphology, and sperm count. The IVF specialist is essentially looking for clues as to why it has been challenging to conceive. Be prepared to have a transvaginal ultrasound at your first appointment. They will look at your uterus, its position, size, shape, and check whether you have any cysts, polyps, or fibroids. They will also assess your endometrium, cervix, and ovaries. Based on the answers you've provided and the blood test results, the consultant will then have a discussion with you and your partner and plan out a roadmap for your IVF journey. You will also have the chance to ask any questions you may have. For example, would you be on the long or short IVF protocol? What would the total cost be? Does this include medication and storage costs? Are there any discounts available? Ask them about the success rate, but remember to take their answer with a grain of salt. How do they usually communicate with the patients? Is it via email, a web portal, phone call, or via WhatsApp? What medication would I be on? Would it be Gonal-F, Cetrotide, Menopur, or Elonva? How long would I be on the medication for? Will someone teach me how to administer an injection? How many eggs can be collected from a person of my age and my health? What would they recommend, a fresh or frozen transfer? Do you do a day 3 or day 5 embryo transfer? Will I get updates or photos of the growing embryo? Do they recommend any supplements to take to improve egg or sperm quality? Hopefully, they should be able to answer all your questions then and there, and provide you with booklets or leaflets for you to refer to for when you get home. The very first IVF consultation is extremely important because it gives you an idea whether to continue your journey with them or move on to another clinic and see what they have to offer. Check out my personal experience in the description below. Best of luck to you guys, and baby dust to you all. Bye!